My name is Shawn Holmes. My whole background is really supporting families and understanding what typical child development looks like, what to do if you have concerns, trusting that parent gut, that parent instinct. They know their kids the best. You've just recently identified some parents that are probably going to need a little bit more help in understanding what doesn't feel right because they themselves have some issues. And so that is definitely something that we'll talk a little bit about. I'm just going to start very, very broadly on child development. Faith did a wonderful job of covering a whole bunch of screening. When I'm talking about child development, we have everything from can that child throw a ball? Can that child pick up a Cheerio? Are they making any sounds yet? Are they able to connect visually with their caregiver? There's lots of little different components, and we chunk them under domains. So cognitive, fine and gross motor, communication and language. And then the one that I'm going to spend the most time on today is social emotional development, because it's going to lead really nicely into what Osley is going to talk about after lunch. And that's really getting at some of those signs of potential autism red flags or other developmental delays. And so again, this is just a breakdown of basic child development, but from here on out, we're really going to focus on social emotional development. Now, one of the other big ticket words is infant mental health. When you hear the words mental health, what kind of comes to mind? What do you think of when somebody says infant mental health? Depressed babies, that's a good one. I've had some people say, I didn't know there was such a thing. Babies can have something going on with their mental health. Some people, when you say mental health, automatically think about what might be wrong. We don't think about healthy mental health when we say those words often. So today, when I'm talking about social emotional development and early childhood infant mental health, they're really synonymous. This is one of those definitions that we use often, but it's really talking about how that baby is feeling inside, expressing themselves outside, and relating to their environment and to the caregivers and the people around them. It's all in the context of their community, their culture, their faith, really being able to take each individual family and each individual child on its own, or he or she on their own. So the easy way that I talk about it is there's these three pictures here that really identify what it looks like. Relationships and bonding and attachment. We've talked a little bit about that. I've heard you guys mention that and how important it is. How well that child can regulate his or her emotions, so emotional regulation, and then security and exploration. Do they have a safe place where they can venture away from their caregiver and explore and know that they can come back and that they are safe? So those are the easy ways of trying to simplify that big, long definition. I think one of our big questions is, what does it look like? What is early childhood social emotional development? And so what I have here is just a 5-minute video. One of the key things that's mentioned in there is being able to support families. How do families know what typical social emotional development even looks like? Babies don't come with a manual. We all know that. We're guessing. We're getting feedback from our parents. We're asking our friends. There's a lot of informal ways that today's parents are trying to find information about what's normal. What is my child supposed to be doing at this age? And how come that child's doing that and mine isn't? There's a lot of guesswork into being a parent. And so some of the things that we really look at when we're trying to talk about early childhood mental health is how to give parents the resources, the types of information, so that they even know what typical child development looks like. So some of the things that I'm bringing with today, I know that you had, or the Community Health Worker Network had an opportunity to hear one of my coworkers about 6 months ago talking about Minnesota's Help Me Grow program. And through that program, there are a lot of different resources that can help support families in understanding early childhood mental health, as well as cognitive development and language development and all other different types. So one of the things that I've brought a whole bunch of things with that I'm just going to be able to go through, but I encourage you to take them, and I encourage you to not only use them with your families, but as you do break for lunch and you look at those materials, what I am most interested in is this even going to work with the families that you're serving? I hear time and time again that printed materials aren't going to work, videos aren't going to work. And so what I'm really trying to figure out is what types of materials speak to our different communities that are out there. And so you'll see, I'm going to talk about it in just a sec, and I'll go through some of the materials, but I'm hoping that over lunch we can have kind of an informal dialogue of what is going to be helpful for you as the community health workers. So obviously we are recognizing that parents are the first and foremost teacher. They are the ones that know their kids the best. If you go into a home or if you go into a visit with a family with that mindset, you're good, right? That's at least one of the things that we go with every time that we're meeting with families in the public health area, is that they're the expert on their child. And if we don't know what that parent's view or their goals for their child is, we're going to be missing the boat as we continue to provide services. Providing resources to families and encouraging them to connect. So you heard from Faith. You are in a prime example spot of being able to encourage families to connect if they are on a Medicaid population, to be able to take advantage of the early childhood periodic screening, the child and teen checkups program. Same thing with many of the other things that I'm going to be talking about. So this website was shared with you about 6 months ago, and there are videos, and I don't know if Kathy McKay was the person here. I don't know if she showed you the videos, and I'm not going to take the time to do that right now because it's something that I could show over the lunch hour. But here is just an example of videos that show what typical child development looks like, all the way from newborn, and it does go all the way up to age 5. And so it's a website, helpmegrowmn.org, where you're able to go, or even direct families to go, where they can watch little video clips on what typical development looks like. The OSLI is going to spend some more time talking specifically about the CDC Learn the Signs Act Early campaign, and that's some of the materials that I've brought with over there. I think the bigger thing is they have neat things on their website that are free that you can order to be able to have with as you're meeting with families. They have everything from little developmental milestone checklists that you can print off. They have growth charts. They have really cool books for kids that are getting ready to turn 3 that are free. These are only right now in English and in Spanish. They don't have them available in other languages. But I think one of the things is they have some great resources that we don't often see for free that you can have access to. And so I think on this slide, hang on. Oh, there we go. Too quick. There. The CDC GOV Act Early, that's where you're able to go and really take a look at a lot of the information. They have little booklets on milestones, and then some of the brochures are over there on the table that you can take a look at over the break as well. The 0 to 3 parent portal, parents are able to sign up for a parenting newsletter, positive parenting tips. The 0 to 3 portal is also where we're able to find some more information for you as community health workers to be able to access on what early childhood social emotional development looks like. I know the one thing that I brought up here, all of the little different things that I have sitting on the table over there, but there's also through the CDC, they have positive parenting fact sheets, and I have those over there where you can just get tips about what parenting looks like. But I think the neat thing about it is fun activities that families can do. So I have 3 children, and I think even with the 3rd children, I would have given anything to have just had some fun ideas, because you get into the mom mode, you get into the family mode, and there's laundry and there are meals and everything. And so for somebody to just be able to give me some little easy things that I could do with my child, I think that's something that some parents are looking for. The other thing that I think you got at the last session are the developmental wheels. I thought I had one, but you've all seen the developmental wheels. We have those in Hmong, Somali, Spanish, and Karen. There are also some other materials over there in all of those languages as well. So one of the things that we have in Minnesota is parents typically, when they have concerns, they're going to start to want to talk to other parents. Where are there other parents that they can connect with? I know faith communities are a huge place for parents to network with each other. Minnesota has an early childhood family education forum. They have an early childhood family education program where I know that there's a lot of parent education and outreach for families. There's a lot of parent support groups, and especially through some of our primary care venues where there's topic-specific opportunities for parents to come together and learn from each other. So what can harm development? You guys tell me. What do you see with your families that causes you to maybe go, oh, I'm sorry, or I hope that, something will be different for that child as he or she grows up? What do you see in the community that you think could harm social emotional development?
There's a lot of domestic violence or neighborhood violence going on.
Domestic violence.
Yeah.
Yep. What else? Depressed? Is that what I heard? Parents? Yes. Parents' mental illness or conditions of the parent? Homelessness. Definitely.
Lack of information.
Lack of information? Yep.
Somebody back here said stress.
Stress. What kind of stress?
Maybe the parent has a lot going on,
Parents always have a lot going on, but if you add on no job, say that again?
Unemployment could be one.
That's what, no job, no secure place to live, no secure food on the table. All of those things. Language barrier. Yes. How are you supposed to connect with maybe supportive services if you're not able to speak the same language? Definitely. So there's this huge list of what can harm development. It's a very scary and foreboding list, right? And then we can add in some fun things like genetics, something that child didn't even have any control over, or the parent didn't even have any control over, and it was just a fate of DNA, right? So there's just a lot of different things that we take a look at. How many of you have heard of the Adverse Childhood Experiences Study, the ACEs? A couple of you. This is something that started across the country. I believe in California is where they originally started this. But in Minnesota, we've done some extensive work really on looking at Minnesota's population. So the whole concept of ACEs is really taking a look at what happens in childhood. What are those key things that happen to little kids that are going to affect them for the rest of their life? And we've seen some very direct correlations with some of these experiences, and it will end up being chronic health diseases for when these are now adults, as well as early death. So I just wanted to show you a little bit about what we know in Minnesota. These are the ACEs. There are 10 content areas. And so you can see there's 3 under the childhood abuse, 2 under neglect, and then we have the household dysfunction, so domestic violence, alcohol substance use, if the parents have some sort of a mental illness, crime, and marital discord. And I know in one of the other presentations I give, it's just divorce, and I think the domestic violence also gets at that. Oops. In Minnesota, when they did this study, out of the entire population that they asked, 28% of the respondents had some sort of a childhood history of verbal abuse. And you can see how that moves down. Drinking problems, parents are separated or divorced, all the way down to an incarcerated household member. So what we see is that for families or for individuals that have more than one of these ACEs, the increase is likely that they're going to experience probably premature death, health conditions, but definitely an array of long-term concerning opportunities and behaviors for that child. So here we go. Asthma. Now I should make sure that because it's so darn small here. This blue column is if they had 1 ACE. This is 2 ACEs all the way up to 5. So you can see from asthma all the way down to health status poor. And this one is anxiety and depression. For individuals that only had 1 ACE, there's a very small percentage that are experiencing depression as an adult. As many as when they experience up to 5 ACEs, that pops up extremely. So you can just kind of see the trend. The more and more ACEs that are burdening an individual, the higher likelihood they're going to experience some of these conditions. Toxic stress. I think one of the things that we talk about is some stress is good. Can you tell me what a good stress is? What's good stress? If a car's coming at you, what are you going to do? Get out of the way. You had your hand up.
I was going to say, trying something new, just challenging yourself.
Trying something new. Definitely. So there is good stress, but it's the prolonged stress that was referred to in the video that I showed to you, this toxic stress, this constant angst, and anxiety that really does its damage on the brain development, especially in early childhood. So I think that's something that we have to be aware of, is toxic stress and how it really impacts the long-term development of a child and their social emotional development. So one of the things that I wanted to show you is we have all of these really big ticket things that we know cause stress. But I wanted to show you a just very nice, simple, minimal level of what it looks like in a parent-child interaction at a very young age. So when something is missing, just the interaction with a mom and her facial expressions and her nice words that she's using with a child. So I am going to just show you one more video. So I always find we talk about families that don't have housing, that don't have food, that there's domestic violence going on, the mom or the dad is experiencing depression or some other sort of a mental illness. And I can't imagine compounding a child's development with some of those factors that really they have no control over. And so keeping in mind just kind of that effect, I think it was interesting the question that you had raised before about who's really keeping tabs on the families, on the parents, the caregivers, when you may be out and about and working with families, who's catching that? Who's recommending to the caregiver that there might be something else going on and that there are resources to help? And I think that is what Faith said. It is a key message that why we really wanted to have this training with you. We've heard over and over again that community health workers are a prime candidate for us to be able to share that message with families. You are in a great situation of being able to provide reputable information and confidence that this is something families can try, that they don't have to just accept status quo. So anyway, so what is social emotional screening? I know Faith spent some time on this, so I'm not going to go into great detail, but it's using a standardized tool. So while we could sit and we can watch a child, we can observe, we can watch a parent-child interaction, there's an actual tool that is used with screening that has been validated, that has been really tested and used with many, many children across the country. It's really looking at what's working. It's not just about identifying what's wrong. It's really looking at what's working well for that family. Where are the strengths? And that's really rule number one anytime we talk about screening is you always start with what's going well. You start with the strengths, right? It's really able to identify some of the more subtle concerns. On some of the screenings that we've done with families, one little side comment written on the side of a form leads to very, very intensive conversations and ultimately some referrals. Yes?
I was just thinking, could you break down the word standardized?
Yes.
Because there are multiple cultures that are here represented, and
Yep.
which some things they may be standardized for you, may
Yep.
not be for others.
And I actually have a slide on that. It's the limitations of screening. And you're exactly right. Standardized typically for instruments that are used in the United States, they have been standardized on the US population. And so very, very small populations of American Indians, Somali families, Hmong families. So yes, while we may say standardized, they've never been validated in specific cultures. And so that's where it's even first and foremost an opportunity for those of you that are working with families to be able to know that we can modify, we can change words, we can make it more culturally specific. So there's a lot of open doors, but I am going to spend a little bit of time on that, and thank you for bringing it up because I know that that's a big concern with some of these tools. But it is definitely, when we look at a standardized instrument, it's taking a representative population of the United States. And so we have very small categories of respondents in some of our key cultural areas that we are serving in Minnesota, okay? It's not a diagnosis. We're not going to be able to label a child with anything at the end of the screen. We are only going to know that something else could be recommended for a closer look. Okay, so it's really, you know, heights and weights, and this is another opportunity for them to take a look at a child's development and find more information if we need to do something else. When we look at a room of kids, oops, of course I went too fast. If I walk into a room full of I'll say 4-year-olds. That was, sorry, if I stutter, I have to catch myself on that. If we look at 4-year-olds, you can walk into a room and you can kind of just by eyeballing, by observation, go, yeah, those guys are doing pretty well. And there's a couple of outliers where you may wonder, I wonder what's going on with them. Something's going on, right? It's the middle part. It's that middle section right here that by just observation, we are never going to know unless we use some sort of a screening instrument that there might be something going on. We have a really nice way of saying good, something, and then it's the ones in the middle that typically elude us, all right? The importance of screening. We know based on national statistics that about 16% of kids in the 0 to 5 range have some sort of a developmental delay or some sort of a behavioral delay, okay? But only about 20 to 30% of those are actually detected before they hit the school doors. And so if you can think about the huge majority of kids that are still sitting out there that we're not catching at this point, and then they do kind of fall into an education mode once they hit that kindergarten door. So standardized screening means kids are getting identified sooner, more accurately, and they're more likely to get the services before they do go to school. There is a little bit of social emotional research that I'm not going to go too much in detail on, but the one that always scares the living daylights out of me is this last bullet. I've been giving the presentation often enough, and then now all my kids are above 3rd grade, and I always think about this statistic, really taking a look at the types of programs that we have in place to be able to support children and families after they hit 3rd grade on up, and that they're really largely ineffective. We need to be able to capture those kids early on, preferably before they even go to school. So there used to be this little joke in the back of my head of, oh, my child's now in 4th grade, too late. That's really not the situation. Kids, no matter how old they are, and families, no matter how old their kids are, there are supportive mechanisms that we've seen some wonderful things happen with. So I don't want that to be discouraging and go, oh, too late, but that's really not the message. The other thing that we've done in Minnesota is we have some data on elevated screening. So if we just screen the entire population, about 5% of them are going to have some kind of a concerning result. If we screen just the Medicaid population, 20% are going to have a concerning result. Taking a look at our child protection population, kids in our child protection system right now, 60% are going to have some sort of a concerning result using a screening instrument. So you can see our interests of being able to capture some of our most at-risk, highest risk families to provide some sort of guidance and assuring that those kids are, and families really are, connected to services before things get too far. So who's screening in Minnesota? Have any of you ever heard of an ASQ or an ASQSC? I see heads. Have any of you actually used one with families? Yes, I was curious about that. So that is really, it's a screening instrument that is typically used across many different types of professionals in the state. And so I was going to share with you who is screening in Minnesota, and then it occurred to me that you very well could be screening, and that's great. So I wanted to share with you from a community level who else is screening. So primary care, you've heard from child and teen checkups, but we know that even kids that are not currently being served by Medicaid, they are receiving screening in primary care. Head Start and early Head Start, kids receive some routine screening. Early childhood screening, that's what we call kindergarten readiness screening or the preschool screening. Really, that's for all kids, and I'm going to talk briefly about it toward the end of my presentation, but that's for all kids before they go to school. Sometime we hope to have them in between the ages of 3 and 4. Follow-along program is a local public health program where they are providing screening. It is not offered in every single county, but it is screening from 0 to 36 months. We have family home visiting nurses. Those of you in the room are probably most familiar with MVNA, the Minnesota. Are you one of them?
No, we're from it.
You are all from, oh, well, I'm preaching to the choir then, okay. They are definitely, a lot of our most evidence-based family home visiting programs, there is screening components. They are definitely using at least the ASQSC, if not the ASQ3. I probably should have asked that when we introduced to know that I have a whole room full of MVNA. The other one is child protection. Anytime there's a child protection incident, those kids have to use an ASQSE with those families. We know that some child care providers are using screening instruments, and we know that some adult mental health providers are using them when they're in the home with the adults, and those adults have children. So there's a whole bunch of people that are screening in the state. And then what I wanted to show you, this is one of those slides that has all these cute little, and then I do that. We're not hitting all of the kids. So I just gave you a really big long list of who is screening in Minnesota, but we're still missing a huge population of kids. The one thing, and I don't know, Faith, if you said this, and I'm sorry that if you did, but out of the kids that are being screened through child and teen checkups, only 4% of them right now are receiving a social-emotional screen. And that feels horrible. Did you say that?
No.
Okay.
Thank you for pointing that out.
It's just such a small percentage of our captive audience. Now, if you look at that periodicity schedule, it's not required. It is recommended. But even for those practices that are starting to try to put that into place, it's still such a small percentage of our kids. So none of these programs are covering what we need. And being able to do that on your own, if you are in the business of doing screening as a community health worker, or to be able to connect families to other services that are conducting screening, or even just reinforcing when they go in for their well child check, that this is an important part of a well child check, and I want to screen, kind of a thought process. The ASQ, the Ages and Stages questionnaire, are two of our most popular screening instruments, and the social emotional is used by every single one of those screening providers that I just talked about. It is a parent report instrument, and then we start to question whether or not their parents are our most accurate and valid resource. What about the parents that do have some mental illness, right? What about the parents that are worried that child protection is just going to take their child away? How are they going to complete a screen? Thinking about some of those, but there are many strengths. Faith said it, and I love the statistic on it. 80% of the time when a parent says, I have a concern, or something's bugging them, they know something doesn't feel right, they're right. Something is going on with their child. 80% of the time. Parents are our most predictive value when we start to look at whether or not there is something going on. It really helps when we use a screening instrument. It creates teachable moments. It's an anticipatory guidance sheet in of itself. It's like this. I mean, it's literally they're able to learn a little bit more about their child's development. And every single opportunity of doing a screen gives you an opportunity to have the dialogue with the family about what feels good. So I wanted to share with you, and this is really small, I'm sorry, what an ASQ even looks like. Just to be able to tell you that it's very, can't even think of the word, it feels okay for parents. So does your child laugh or smile when you play with her? Very easy question, one that I think the majority of families are not going to feel stress about answering, right? When you leave, does your child remain upset or cry for more than an hour? So I just kind of wanted to show you an example of what these questions are that parents are asked when they do complete a screen. But there are limitations. No screening is 100% accurate. We're not always going to leave a screen with knowing what's best for that child and that family. We have to make sure that the screening is interpreted in the context of that child's culture and the child's experience. So if we have a new immigrant family and we conduct a screen, what do we have to be thinking about? Their past, any trauma, how they came to Minnesota to begin with, and what they experienced before they even came. So an ASQSE used on a new immigrant family versus someone that's been here since birth is going to feel quite different. And so there's always some cultural context that we have to keep in mind anytime we do screening. We have to know if a child has even had an opportunity to try things that we may be asking on the screen. Has that child ever even seen a scissors? Has that child ever been allowed to use a crayon? There's a lot of different questions. Are mirrors something? So one of the questions has to do with, does your child look at themselves in the mirror? And in some of our cultures, that is not an appropriate developmental milestone, right? And so there's lots of little things that you can help if you are conducting screening, or you know that you can know that things can be modified to make sense for that child's culture. So the other thing on here, so while we have standardized tools, smaller specific groups are usually not well represented. And unfortunately, we do not have a list of screening instruments that have been validated and used in every single one of the populations that we're serving in Minnesota. So we're doing the best that we can. We can go under the surmise of one screen is better than no screen at all. We could try that. But I think some things that we're learning, especially through folks like you, is whether or not some of our screens are doing more damage than good. Are we opening doors using a specific screening instrument that really we need to take a step back and think about? And so that's where your expertise comes in as you're working with families to know, you know what, this is not going to work for my families. And to be vocal about that, because we are some of the people that really need to be able to hear that. So when you bring a screening instrument to families, this whole left side here is, are they judging me? Am I answering this right? We know that some of our families, they like to play it safe, so they're just going to do all of the right in the middle. You know, I'm not going to be too good and I'm not going to be too bad. We're going to see how that goes, right? Will I lose my child? Is it a fair test for my child's age, race, or culture? We've now just kind of learned that, no, maybe not. Maybe not some of them, right? And can I trust this person? That's again why we're in this room with you, hoping and expecting that you have some nice relationships with the families that you're serving and that you're a better spokesperson than some of us. And positive side, what can the screening show me about my child? What can my child do? How does it support me as a parent? And what do we get out of it? And so that, again, anytime there's screening, is being able to provide some added support to families, and really what it looks like for when somebody walks out the door, of how that family can move forward after that point. So your role, supporting families' comfort level and access to screening. You're able to explain developmental milestones. You're able to give them some of these pieces of information about what typical development looks like. You can normalize it. So you go to the doctor and you check your height and you check your weight. This is another component. This is something we like to take a look at. Social emotional development tells us how your child is relating to others, how they're feeling inside, and how they're able to regulate themselves. And there's a lot of really nice user-friendly words on many of the websites that I showed you before about how to talk about it. So what do you do, those of you that are screening, what do you do when you have concerns? I like to put people on the spot. You connect them to resources. Yep. Or is there like one or two big ticket resource that you use? Help Me Grow. Great. How about to primary care? Their doctor? Have you ever sent anybody to an early childhood mental health provider? That's a tough one. Do you know who they are even in your community? That, I think, is the biggest challenge. Who's even qualified to work with families that have children under the age of 5, right? Okay, so there are 3 huge referrals that we take into consideration regardless of screening results. Sometime all it takes is a parent's comment and we will start to look at start looking at referrals. It just really depends on that dialogue with the family. So I'm just going to break it down pretty quickly here. A medical evaluation. There are a lot of things from a medical setting that might not be captured in some of our other automatic referrals, and Faith alluded to several of them. Lead, huge one, right? Lead and its result in a child's behavior. Nutrition, sleep. A lot of families, when my child doesn't sleep, is there something medically going on that we need to be paying attention to? So from a medical evaluation, there's a lot of information that can be really eliminated or crossed off. Well, we know it's not that, and we know it's not that, and we can really get at the source of what's going on with the child. Here's just a quick list of all of the different things from a medical setting. I'm not going to go through them. The educational evaluation, we call it Help Me Grow. In Minnesota, if you have concerns and you know that that child maybe could use another set of eyes, another set of trained early childhood eyes to see is that child developing is typically developing as peers. Sorry, I'm moving my words. But really, one of the things is really being able to assure that those children are referred so that they have an opportunity to connect with services that can get their child ready before they go to school, before they walk in that door to kindergarten. When you do refer for an early childhood Help Me Grow referral, and again, this is probably something you received about 6 months ago, that helpmegrowmn.org website that I had up earlier, there's a nice place to be able to find information about what a referral looks like, what happens after a referral, but this is also a place where families and yourself are able to help families complete a referral so that then the local school district can connect with the family and talk about services. I know that that can be really scary for a lot of our families to be able to pull in the school. And so I think that really having an opportunity to familiarize yourself with what happens after a Help Me Grow referral happens or is made, that can help you maybe hopefully put the family more at ease. I'm not going to go through some of that because I think that happens. So mental health, this was the biggest one that I really wanted to be able to get to. On the table, I have this and then some contact information. The Department of Human Services has a grant where they have trained early childhood mental health providers in every single county of the state. And so if you could see in the Hennepin and the Anoka and all of this metro area here, these little symbols align with one of the early childhood mental health providers. But on the table over there, you have the phone number, the contact information for who that person is. These people are actually paid to be able to support families with children under the age of 3. They are working with families with children of all ages, but they have specialized training to work with kids under the age of 3 and how to really do more of a family support network. This isn't about the child going in and having some sort of psychotherapy. This is about the family unit and being able to support the family. There are many other community supports to help with healthy development in Minnesota. And I think I've just kind of put up a list here so that you're familiar with what some of those other local community efforts are. So we have family home visiting in the follow along program. I have another slide where I'm going to talk through on that. We have early childhood family education, early childhood screening, and then any of the families that are currently in the Head Start, early Head Start realm. So early childhood family education. How many of you are aware of this? I'm hoping all hands go up, but no, not all. Okay, so this is a great program. It is not free for all families, but it is on a sliding scale fee. So some of our families probably are still able to receive this for free. It's an opportunity where they can go, they can have playtime for their child, they can interact with other parents in their community, they can learn about typical child development. It is available in every single school district in the state. So if you're familiar with the school district, this is something that I would highly encourage you to take a look at a website, contact a school person that you're familiar with, and ask more questions about what does ECFE look like in my community? And is it culturally appropriate? That's another thing that I know in some of our communities, they are actually having more specific cultural topics related to the communities that are currently being served. And I have to put the onus back on you. I need you to really research what this looks like in the community because it does look different in every single school district. But that is something that's really out there to be able to strengthen families and to work to increase their ability to understand early childhood development. Yeah, I'm extremely biased. I used to teach it. And if I could just make enough money to pay for my gas and live, that would be what I would be doing every single day. Those teachers are not paid well, and they should be paid a heck of a lot more. But the other quick thing is my sister who lives in Wisconsin, I told her when she was looking for opportunities for her young child, ECFE, they don't have it in Wisconsin. They don't have it in any other state that I've been able to find. Minnesota is very, very unique for this opportunity. And a lot of parents don't know about it or they can't access it. And I know in a couple of the communities, and this is why I encourage you to get involved and connect with the school on this, because there was a homeless shelter in St. Paul where it was really neat to be able to have an ECFE experience for those families. And ECFE went to the homeless shelter and did an ECFE class there. And I think that's where you guys come in. If you see needs for your families, you're able to connect with the schools and really be able to talk through that. How can we support these families? Because they're not going to come to you. So let's make this work for families. So that's a fun program. Early childhood screening. We've already spent time talking about that. This is a required component. All kids are required to go through an early childhood screening in Minnesota. Again, another unique feature of Minnesota. However, there's a whole population of kids that show up on the first day of kindergarten that never had this early childhood screen. This is a wonderful opportunity for sometime in between the 3rd and the 4th year of that child's life to be able to have a full-fledged developmental and social-emotional screen. And they walk out, parents walk out, those of you that have kids that you've gone through this, parents walk out with a really nice new mindset about what their child's strengths are and what some of the things are that we can be working on before the child hits kindergarten. And if that child does have concerns, they can start services immediately and hopefully get them back on track and ready to go before they hit the school doors. And then the follow-along program, oops, I'm almost done. Ooh, we're getting close. The follow-along program is currently provided in 80 of the counties. We have 87 counties in Minnesota. It is provided in Hennepin County. We have some big gaps with Ramsey and Anoka County. And then I put all of the other little greater Minnesota counties up there that currently don't have it. This is something that when those babies are born, local public health connects with them and they offer ongoing periodic developmental and social emotional screening until their child hits 36 months of age. So families will receive an ASQ or an ASQSE in the mail. They complete it, they send it back, it's scored, and if there are any concerns, a public health nurse will call and talk with the family, really talk about next steps. At the very minimum, connect families to ECFE and connect families to child care resources that might be available in their county. So there's a nice myriad of family-centered connections that can happen, as well as access to early childhood screening. Okay? What can you guys do? So after hearing all of this, this is my little wrap-up slide. The most important thing that I think I would always recommend for anybody sitting and working with families is to listen. It's amazing what you'll learn from a parent given an opportunity to talk about their child, and they're so proud of the neat things that their children can do, and you'll learn so much. So being able to listen, understanding the impact of trauma, and where those families originated from, and what brought them to Minnesota and why you're in their home. Helping them understand typical child development. I've given you a bunch of resources and I am very interested to know if you think any of them are worthy to work with the families that you're serving. Stay connected with your community partners. Touch base with that early childhood mental health provider that's close to you. Find out what it looks like when a child goes and visits with them so that you can tell the parent, I've talked with so-and-so. This is what will happen when you go there. Really, you having that understanding is going to help parents feel more comfortable. And then helping them become aware of some of those other services, such as ECFE, early childhood screening, child and teen checkups. There are so many different services out there that it's really overwhelming to be a parent and to really know what's best. And so that's where I see your biggest stand as far as working with families, just to help them connect.